All right, so my project is on Quaaludes. The generic name is methaqualone, and they are in the sedative class, and the action is very similar to benzos, kind of like Xanax and Valium and those sort of drugs that are on the market today. It's Quaaludes are currently a Schedule 1 substance, meaning that there's no accepted medical purpose and that research is strictly regulated. And they were pulled off the prescription market in 1984. So they were prescribed originally for anxiety and insomnia, and users could go to these stress management clinics to get them. They were very loosely regulated, kind of like the pain management clinics that were kind of helped propagate the opioid crisis that we're currently facing right now. Um, the action of Quaaludes, very similar to Xanax, increasing the GABA receptors in the brain, the potential for GABA uptake, serotonin. So, therefore, the treatment options are very similar to Xanax addiction. Because it's kind of a relic, if you will, there's almost no recreational user base left in the first world, pretty much. So there's really no like specialized treatment programs for Quaalude addiction, but the the NIH does offer some basic guidelines, just saying not to quit cold turkey, to check yourself into a rehab facility where they can wean you off and monitor your detoxification process, and then to follow up with behavioral and cognitive therapy. Um, so some of the long-term effects of Quaalude use include gastrointestinal issues, liver damage, blood vessel deterioration, jaundice, and then also anxiety, depression, and many other mood disorders that you might have uh, taken the drug in the first place to treat. So really not super good there. Um, as far as current users go, there's really not much of a user base anymore because all of the um, all of the companies that produced the drug kind of got sued into oblivion, and it was pulled off prescription markets in pretty much everywhere. There is a niche user base in South Africa, and there's a pretty interesting little Vice documentary on YouTube about that if you guys want to look it up. But other than that, this concludes my project for the day, and thank you guys for watching.